Hello. Today I have a banger for you. I call it autism. Autism spectrum disorder. ASD. I call them special people. Autism involves challenges with social communication like eye contact, difficulty understanding things and situations, and repetitive behaviors. I'm going to go to the causes. I'm going to go to the symptoms. I'm going to go to the treatment. You're going to get all of that right now. Please listen. This is only for educational purposes only. Let's go to the causes of autism. A medical examination reveals that there's no known cause, but an environmental factor has been identified. For example, number one, using certain kind of medication during pregnancy, such medication as sodium valproate or valporic acid. Some pregnant women use this medicine for migraine or for very tough headaches, during pregnancy. So that is sometimes is the cause. We are not pinning it on anything in particular. Let's go to number two. Becoming pregnant after age 40 sometimes may trigger autism for the kids. Number three, becoming pregnant again after delivery under 1 year. That's 12 months. Let's go to number four. Having gestation diabetes. Pregnancy, diabetes, Let's go to number five. Having bleeding during pregnancy. Is also a cause. Sometimes, yes. Then number six, which is about the last for that, but not the least. Reduced oxygen to the fetus during pregnancy or delivery. These are all we just dealt with the causes. Now let's go to one of the most important questions that people always ask. Is autism inherited? Yes, it is so easy to confuse genetics with inheritance. Yes, some people mistake these two. But finally, I want to give you this final word. It is possible for biological parents to pass down gene variation to their children. Experts think autism can be inherited because they see patterns among siblings. I hope that is clear. So when we say, is autism inherited? Yes. Yes, it's inherited, especially when the parents have these symptoms, have this, and they are passing it through their genes to their children, and other siblings too. Let's go to symptoms. These are the symptoms, and then after symptoms, we'll be going straight to the treatment. Let's go to the symptoms. Any autistic person may present at any age. These are all the symptoms that you'll be getting. Now, the first one is they seem uninterested in starting any communication. Number two, they have difficulty expressing their feeling or understanding how others feel. Number three, they have difficulty understanding sign language. For example, they might even look away when you are trying to address them, when you are trying to correct them, when you are trying to tell them something. Number four, they speak in monotone or sing song voice. Their voice may be sounding like they're singing. Number five, they have difficulty in noticing social cues like face expression or body language. Like you're trying to give them a cue with your body. No, they don't understand that. Like I told you, they are special children. They are special people. Number six, they make little effort, little or no eye contact at all. Number seven, they don't socialize easily with others. They want to play alone, move alone, stay alone. That is their preference. Number eight, they don't follow rules like greeting or personal space. No. Number nine, they repeat words or phrases. Number 10, they repeat motions like flapping their hands or spinning in circle. Yes. Number 11, they get very upset by changes to their routine. When you try to change what they are doing, they get very upset. Number 12, they won't eat food of certain texture. These are all the signs and symptoms that are associated with autism. Then finally, let's go to treatment. Then I want to ask you now, do you think there's a treatment for that? Let me give you an answer. There's no known treatment for autism because autism is not a sickness. It's not an ailment. But however, there are medications to manage symptoms like hyperactivity or anxiety and a number. But clearly there are therapies that I'm going to break down for you now. There are therapies that are there to manage this autism in our siblings, in our brothers, in our children. The first one is speech language therapy. Yes, this one helps in communication. There are like 4 therapies I'm going to mention to. The first one is speech language therapy. The second one is occupational therapy. This one is for daily living skills. The third one is physical therapy for movement. And the last but not the least is behavior therapy. It helps to build skills. These are all the things you need to. These are all the big questions you need to know about autism. They are very lovely and wonderful people. They are special children. They are our family members. They are our children. They are our siblings. They are our sisters and brothers. So we must all look out and take care of them. I'll see you in the next. Don't touch it.